Here's another case. This is a 30-year-old something guy. He's down in Mexico on a vacation. He has a little bit too much happy juice, and he decides that he's going to jump from a cliff. He goes down, and he's got back pain. Not only does he have back pain, but he's got searing leg pain, buttock pain. He comes back to the States. He goes to his medical doctor. He gets what? He got oral steroids. He could have got an injection. He got oral steroids. So he comes to us 3 months later, okay? 3 months have gone by, and he's still suffering. He can't sleep, he can't work, he's having a heck of a time. And there's the MRI. He's got a little bit of weakness actually in the extensor hallucis longus, so great toe extension is minor weakness, grade 4 weakness, not a functionally impaired situation, but weakness nonetheless. Very strong pain with slumps tests, straight leg raise, all these things that we would normally test for neuromeningeal stretch and tension. And what did we choose for him? Well, first I'm sorry to do this to you, really. I'm making you suffer now. You know, I'm kind of old school. I'm not quite safety pin or foot on the hose, but I'm still talking about the disc with patients as if it were a jelly-filled donut, right? Who doesn't? Do you all do that still? Because I do. And I say, hey, you got a jelly-filled donut in your back. You've got a situation where you created an injury to the containing fibers of that disc, and that jelly has found a way, a fissure, to the periphery, and it's oozing and it's deforming the disc. And our task, our job, is to try to relocate that. And in this case, we use that to explain why we chose flexion distraction. And in flexion distraction, the old principle, I know there's some changes, but the old principle is that we create a negative hydrostatic pressure, right? We create a vacuum effect, so to speak, within the disc. A negative pressure within the disc so that it sucks back, so that it withdraws and decompresses the nerve root, right? So that is all we did with this patient. We did E-stim for pain, but the only modality that we applied was flexion distraction. And he made also 100% recovery. 100%. And the strength came back and everything was very good. He was very pleased. And again, how long did that take? Probably wasn't overnight, but within a period of 2 months, he was doing well and back to work.